Hello, and welcome to UCI Health's Rehabilitation Services. In this video, we will demonstrate the correct form and procedures for safely transferring a patient from the bed to the wheelchair. However, these principles and techniques can be applied to other objects or places, including chairs, commodes, cars, showers, or tub benches. Prior to moving the patient, prepare the room and transfer surface. Clear all unnecessary materials that may pose a trip hazard. It is important to have a flat and clean surface to reduce the risk of slipping or tripping. We recommend that rugs be removed throughout the house to prevent tripping. Move all sheets, blankets, and pillows away from the patient to ensure a clear space for movement, and to avoid any interference during bed mobility or the transfer. It is important to have the transfer surface, in this case a wheelchair, as close to the bed as possible. This reduces the risk of falling because it is less distance to travel and takes less effort. A 45-degree angle between the edge of the bed and the wheelchair is ideal to minimize the distance traveled between surfaces. If the patient has a weak side, position the wheelchair on the patient's strong side. Apply the brakes on the wheelchair so that it does not roll away, and make sure the wheelchair's casters are rotated backwards so they are not a tripping hazard. Then, remove the armrest to provide a clear path for the transfer. When you're ready to move the patient, bend the patient's knees up in preparation to roll them from their back to their side. This leg position will assist in the roll as the momentum from moving their legs to the side will subsequently move their torso to the side. Position yourself on the side of the bed that the patient is moving toward to best assist the patient and prevent them from falling off the bed. During bed mobility and transfers, keep your back locked in an upright, straight position at all times. To get low, bend at the knees and lower your hips to the ground. This will protect your back from injury. In addition to moving the patient's legs, assist the patient in rolling from their back to their side by placing one hand at the shoulder and the other at the hip. The patient can also assist by reaching across their body toward the edge of the bed with the arm opposite the side of the bed they are rolling toward. Next, assist the patient to lower their legs off the edge of the bed. If possible, the patient can sit up on the bed by pushing off with both arms. If the patient needs assistance in sitting up, you can stabilize at the patient's hip while simultaneously lifting at their shoulder. Again, maintain a straight back and bend at the knees to avoid straining your back. If the patient is able, they should lean forward and move their hips closer to the edge of the bed. If assistance is needed, you can facilitate this by moving the patient's hips, shifting them one at a time. Shift the patient forward until their feet are placed firmly on the floor. If a gait belt is available, it should be placed low and tight around the patient's hips. It's recommended to tuck in excess slack on the gait belt to avoid getting caught during transfer. The patient and caregiver should both use proper footwear. Be sure to choose footwear that provides stable support and tread to limit slipping. One of the patient's legs should be positioned between your legs. This allows you to squeeze the patient's leg between your own. This serves as another point of control while transferring. At this point, the patient can lean forward to shift their weight forward. If the patient is able, they can reach for the nearest armrest on the wheelchair with one hand, while pushing off the bed with the other to assist you with the transfer. Hold on to the gait belt at both sides of the patient's hips to serve as a point of control for leverage during the transfer. The patient should avoid holding on to you, as this may cause injury. As the patient leans forward, hold on to the gait belt and lean backward to leverage the patient up off the edge of the bed. Stagger your feet with one behind the other to receive the weight of the patient and maintain their own balance. As the patient clears the edge of the bed, pivot the patient toward the seat of the wheelchair, guiding the patient at the hips using the gait belt. Pivot your body along with the patient during the transfer. Do not simply twist your waist, as that could lead to injury. Before lowering the patient into the wheelchair, the back of their legs should be in contact with the seat. This will ensure the patient is lowered adequately into the seat and not too close to the edge where they may be at risk for falling off. Once the patient is in line with the seat of the wheelchair, bend your knees and squat to lower the patient into the seat, guiding at the hips with the gait belt. Thank you for watching this video on safely transferring a patient from the bed to the wheelchair. For more information on UCI rehabilitation services, please visit us at ucihealth.org/rehab or call 714-456-5571.